Uterine fibroids, also known as leiomyomas, or myomas, are benign non-cancerous tumors that originate from the smooth muscle layer and the accompanying connective tissue of the uterus. They are the most common type of benign tumors in women of reproductive age. What are the types of uterine fibroid? These include 1. Intramural fibroids. These grow within the muscular wall of the uterus, and are the most common type of uterine fibroids. 2. Submucosal fibroids. These develop just under the lining of the uterine cavity and can protrude into the uterine cavity. 3. Subserosal fibroids. These grow on the outside of the uterus and can extend outward. And 4. Pedunculated fibroids. These are attached to the uterine wall by a stalk-like structure which holds them in position. Having known all of these, the next significant question to ask is, what symptoms does uterine fibroid present with? First of all, many women with fibroids experience no symptoms, but when symptoms do occur, they can include 1. Heavy menstrual bleeding. 2. Prolonged menstrual periods. 3. Pelvic pain or pressure. 4. Frequent urination. 5. Difficulty emptying the bladder. 6. Constipation. And 7. Backache or leg pains. Another important question that disturbs our minds is, what causes uterine fibroid? The exact cause of uterine fibroids is unknown, but several factors may contribute to their development. These include 1. Hormones. Estrogen and progesterone, which are hormones that stimulate the development of the uterine lining during each menstrual cycle, appear to promote the growth of fibroids. This is because uterine fibroid cells have more receptor for estrogen and progesterone. 2. Genetics. There is evidence that fibroids may run in families, suggesting a genetic predisposition. And 3. Growth factors. Substances that help the body maintain tissues, such as insulin-like growth factor, may affect fibroid growth. Having said all of these, the good news is that uterine fibroid can be treated. The treatment for fibroids depends on the size, location, symptoms, and whether the woman wishes to preserve fertility. Treatment options include 1. Watchful waiting. Monitoring fibroids that do not cause significant symptoms. 2. Medications, such as gonadotropin-releasing hormone agonists. Example includes goserelin and triptorelin. 3. Progestin-releasing intrauterine device. 4. Nonsteroidal anti-inflammatory drugs, such as ibuprofen, naproxen and diclofenac. 5. Oral contraceptives, such as ethynylest radial and levonorgestrel. 6. Non-invasive procedures, which includes uterine fibroid embolization, that is, blocking blood flow to fibroids, causing them to shrink. And magnetic resonance imaging guided focused ultrasound surgery. This uses high-frequency sound waves to destroy fibroid tissue. 7. Minimally invasive procedures, such as laparoscopic or robotic myomectomy. This involves the removal of fibroids while preserving the uterus. And hysteroscopic myomectomy, which involves the removal of fibroids through the vagina and cervix. 8. Traditional surgical procedures, such as abdominal myomectomy. This involves removal of fibroids through an abdominal incision. And hysterectomy, which involves the complete removal of the uterus. This is the only permanent solution for fibroids. In conclusion, uterine fibroids are a common condition that can affect women's health and quality of life. Early diagnosis and a range of treatment options can help manage symptoms effectively. Women experiencing symptoms should consult their healthcare provider to determine the best course of action based on their individual health needs and lifestyle. Do not forget to subscribe, like and comment. Stay safe and healthy.